Okay, first of all, for the listeners, please feel free at any time during the show to call 718-683-5858 with any questions, whether it's from previous shows or the show that we have tonight. We'll be discussing tonight pain. We'll be discussing in terms of different therapies and who should give you advice about which therapy you should go to, and finding the right answers, the right doctors for you. Also, with Hashem's help, we'll hopefully get to hypnosis, which I'm a doctor of clinical hypnosis and a psychotherapist. And any questions about hypnosis, how it works, is it safe? What part of the subconscious do we get to? What levels? How could it be used, whether it's entertainment or in a clinical way? So please feel free to ask the questions. Regarding any other shows or any questions you might have, you could always reach me in my office or my secretaries at 718-621-2179. Okay, feel free to call, and we're going to continue from what we were talking about 2 weeks ago in terms of pain. Now, in terms of pain, there's different categories. We have the regular sciatic pain, regular real pain that exists. I've had a case, somebody had a spinal injury overseas. They had spinal pain and a spinal injury, which was treated. They had surgery, but the pain kept on happening and occurring day after day after day. For 7 years, I came in for the consultation. Actually, during the consultation, I did one treatment for pain that I came up with many years ago, and the pain just went away, and we never did a second treatment. Just to show the power of hypnotherapy, or if you touch the right spot in the subconscious, how the pain can be controlled. There's also pain that's very interesting, Nissim. You'll find how Hashem made the human being. The human being, if they have a lot of things bothering them subconsciously, so the subconscious mind has a defense mechanism. Very interesting. In other words, Hashem made it that somebody has a lot of things bothering him, and it's like in his mind. So the subconscious mind will work with the autonomic nervous system and cause certain issues in the body. The famous ones are going to be lower back pain. It could be allergies. Could be mono, Epstein-Barr. So this is a reality that occurs in many people who have pains, especially if somebody has, or listeners will relate to this, if they have a pain or they know somebody who has pain and it somehow jumps around from place to place. It was the right leg, now it's the left leg. It was the back, but it moved now to the neck and shoulders. That's a typical sign that the doctors are going to be a little bit, at odds. What's going on over here? But that's a typical sign that the subconscious is basically working with the autonomic nervous system and taking the pressure off the person's problems by putting their mind on the physical pain to protect them subconsciously from things that bother them. This is a reality, and it happens in a lot of cases. So we have real pain, we have subconscious pain. We also have pain that sometimes a person has an injury. I've had many cases like this, that there's a very big difference. If there's no inflammation, which basically means if there's let's say a leg injury or a muscle injury. So one problem is the injury itself. The other problem is that because of the pain, there slowly builds inflammation around the injury, and therefore a person walks on their leg, it always tightens, and inflammation doesn't have a chance to heal. So these are special cases where there's a special technique of pain treatment that basically used to force the muscle to relax so the inflammation can heal. It needs a little more hesber, a little more understanding. But in short, these are the categories that if there are any questions, please feel free to call 718-683-5858, and I can elaborate on any questions that you might have regarding pain. Any questions, Nissim?
No. Right now, you know what? I want. I don't know what microphone. My microphone is not so good,
Okay.
and I have to scream. So just it seems like okay. So you want to discuss another issue? So continue, and I have my own.
Okay, sure. Did you want to discuss the issue in terms of the job of teachers and the job of educators, in terms of if they see a child, or in high school they see somebody who has a problem, what should they do? How should they react? My microphone's okay, by the way?
Yeah, yeah.
Okay.
Okay. You know what? You're touching a very a strong point. It's not only educated teachers. It's also psychotherapist and all this kind of profession that somehow what I got a lot of response. I got quite a few phone calls and some people that contact us and tell us horror stories about situation that not so professional stuff. It seems like many times we found ourselves with people that sometimes like to control other people's life. And it's what do you think about it?
Okay, very, very important. And again, this show is basically uh, about improving, our lives and directing Yidden the right way and getting the right help. We have a call in the meantime?
Yes, we have a caller.
Okay, I'm sorry. We'll continue soon. We have a live call. Yes. Dr. Baharav
Hello,
here. How
good
can I help
evening,
you?
Dr. Baharav.
Good
How are
evening
you?
to you. Thank God. How are you?
Thank God, thank God. I have a question. I'm suffering probably 6-7 years from a sickness in the bladder that is called interstitial cystitis. Not many people know about it, but I'm on pills. It helps a little bit, but sometimes I have terrible pain. The pain is really severe, and it's hard to get from it, get out of it. It only works with very, very strong pills that I'm not allowed in my condition to take. And I was wondering if you will be able to help me with this pain.
Okay, first of all, soon I'll speak about that. I want the listeners to understand we have a caller with interstitial cystitis, which is basically a very difficult bladder illness. It causes spasming of the bladder, which in turn leads to inflammation around the bladder, making the spasms worse and making it very, very difficult to cure. And also, these are people who go to the bathroom very, very often. So if you're a listener who has a problem in terms of going to the bathroom very often, I suggest you see your urologist. If it's not a sugar problem, it could very well be the interstitial cystitis. Now, who's your urologist?
Dr. David Kaufman.
From Manhattan?
Yes.
Okay. In fact, I had a meeting with him a number of months ago, and I told him about my treatment for pain, and I found out that it does work for interstitial cystitis. He called it a miracle cure. Now, the way I can explain you is like this. The way to solve this illness, even though it's known as something incurable, and they give you probably medicine, but through the subconscious mind, if the muscles of the bladder, the whole trick over here is to stop the spasms in the bladder. Now, if the muscles and allow the inflammation to heal, because the inflammation will not heal by itself. And if the subconscious mind controls the autonomic nervous system, and it can actually, with the pain treatment that I have, there's a way to actually cause the bladder muscles to force themselves to relax, and thereby allowing the inflammation around the bladder to become less and less. That will only occur that way because naturally the spasming causes the inflammation. So it's like somebody has a heel spur, so the only way is to wear orthotics and take the pressure off so the inflammation can heal, and therefore even if they have a heel spur, they don't feel that pain. I hope it explains it. It sounds a little complicated, but there is a way to stop the spasming of the bladder, and that's really, really where the focus is. And it's also going to touch on the topic that me and Nissim are talking about in terms of treatments, getting to the root, getting to the right therapist, the right doctor, somebody who's going to, hey, I'm being treated. It's 3 years already. There's no such thing. A person should begin to see results in almost every treatment within the first few weeks or a month or two at the most usually. But to stop the spasming of the bladder and allow the inflammation to heal, that's where the answer lies in terms of treatment for interstitial cystitis. He actually called it a miracle cure. He said he's going to let his clients know. This was a number of months ago. But I wish you the best of luck. If you need to contact me, I hope you can call the station, or the office number is 718-621-2179. And please, for the listeners, please call the show with any other related issues, whether it's muscle issues, pain issues, or psychological issues, to 718-683-5858. Thank you.
Thank you. Thank you very much.
Okay, so we're speaking with Nissim in terms of the diagnosis. And again, it's very important to remember the Chazal, Le'olam yargil adam es atzmo lomar, eini yodea, I don't know. I don't know. Now, for educators, for teachers, Le'olam yargil adam es atzmo lomar, eini yodea. I just want to give one short example that not long ago, it's a number of weeks ago, I had a client in my office, and she says, well, her son has this problem, he has that problem, and an educator said, listen, he drinks, he's on drugs, he's on this, he didn't want to come to you, Dr. Baharav, and since he didn't want to come, so one of the educators said, you know what, you have to throw this person out of the house or put him in the army, let him learn the hard way. So I said to her, I go, listen, you know what? That's not right for him to answer, and it's not right for me to answer as well. I said, listen, I'll give you two choices. Either you want to go to Chaim Kanievsky, or you want to go to David Tzera, who I've heard good things about, and of course, Chaim Kanievsky, she's Sephardi, so I mentioned to her also Yaakov Buchatzera, Shlita. So I said, this is something that you need a shaliach, one of the Gdolei Yisrael, to be able to tell you. And in fact, she called Chaim Kanievsky. She had a contact, and he said, no, you need to refer. They have to go to the right person for Kiruv, for a special program. And I actually said to her, and lately I've been thinking I would love in the future, should Hashem give me the possibility to have in schools somebody who, if there's a girl in trouble, if she's off the derech, if there's somebody involved with, girls, boys, things that shouldn't be happening, if there's a problem of drugs, there needs to be, the schools have to know, they have to know a number, they have to know of a person, they have to know of an organization who's going to direct them in the right way. This is not for your average teacher or educator. And, I'm dealing with a case now. There could be somebody, there could be a couple that one of them has major psychological, psychiatric issues, and the husband doesn't know what to do, and they're going to refer them to a marriage therapist, and the marriage therapist might deal with it in the totally wrong way, as a Shalom Bais case, which is something I'm involved in right now. And I don't like to scream, but I was speaking very harshly in terms of, whoever came up with this idea, because you have to focus on what is the problem and how do you fix it, like a surgery. You can't operate on an arm when the problem is somewhere else. And if one person doesn't understand, if somebody is in that situation, I have certain cases, two topics I won't talk about, that I don't even accept, and I tell people straight. But le'olam yargil adam et atzmo, the wise man is going to know when to say, I don't know, I want to refer this to somebody else. I want to ask the advice of a Gadol B'Yisrael. I want to ask a top psychiatrist, or I want to ask somebody who's top in diagnosing, or top an expert in OCD or in pain. But this is very, very important to know. You want to be an expert educator, you're a great whatever it is, but just to know when we need help from an outside source. And I personally just gave you an example, and this is a true case where I said, I don't want to answer. I want Chaim Kanievsky, or I want Yaakov Abuchatzer to answer. I was also involved a few years ago with the Tosher Rebbe, and I had a case that to help somebody who's supposed to get married in 48 hours, and will the marriage go on or not? And after one day, I was pressured to give an answer, and I told him, ask the Tosher Rebbe, because I can't answer something like this. He's not cured yet. He still needs help, and I can't predict the future, so have the Tosher Rebbe give you. And the wedding did go on, and Baruch Hashem, they have children, and Hashem shall help further. Yes, we have a phone call.
Hello, you're there.
Yes, you're on with Dr. Baharav?
Hello?
Yes.
Yes.
Yeah, good evening, Doctor. Good evening, Rabbi. Question, you're talking about pain that travels. I have pain in my left foot, sometimes the top part, sometimes the bottom part, and I always think it's coming from my back. This has been going on for several years already.
Okay, is it always coming? Like, do you feel a pain in your back?
No, I haven't felt pain in my back, Baruch Hashem, for a couple of years now.
Okay, but physically you checked everything out, because, by the way, for listeners, the first thing when it comes to pain is, check it out physically. When you see that there's no physical cause, then when we're talking about, pain caused by the subconscious, that's when the category exists after you've checked yourself physically. You checked yourself out, you're fine?
I went to a chiropractor, and he did a couple of treatments on me, and then everything seemed okay, and then for some reason the leg continues to hurt off and on.
Okay, so something like that, you should call the office, because, again, if there's something wrong or you got injured, what's this off and on? Either there's a problem or there's no problem. When the pain is going to travel like that, and I have people, like I mentioned, whether it's the shoulders, lower back is common, but again, I see it could be in the legs, also fingertips are common. The lower back is the most common. In terms of like a sciatic pain or something like that, it doesn't sound like something like that at all, especially it comes on and off. Is it a very strong pain?
It's always
Best of the Jewish world. Jroot.
Yes, you could hear me?
Yeah, I can hear you. It is, sometimes it's more intense, sometimes it's less intense, and I usually feel it more in the morning.
Oh, you feel it more in the morning. You're working?
Yes, sir.
How is it in weekends?
No, I don't work weekends.
But how is it in weekends, the pain?
I've never thought about it.
Think about it. Might be interesting. What happens Monday morning? Monday morning, it's you always have it?
I can't tell you. I'll have to pay attention in the future.
In the future, but it does sound that it could be under this category. I don't like to diagnose over the radio show, but it sounds like it's any pain that's going to move around, or you're going to have it and then it's going to stop for a few days and then it's going to come back. It's usually under this category. Okay, I hope this
Okay.
answers your question. Hatzlacha.
Thank you very much.
You're
Amen.
welcome.
So, doctor, let's see that my question is still on the air. How do you know that you're coming to the right place? It's very it's very frustrated and already painful and painful from all sides, even the finance problem. Very painful that people coming and going to therapists, getting the educators and stuff like this, and everybody getting you confusing. Let's say that you're going to medicine, you have problem with your leg, so you go to a specialist with the leg. But here we're talking about basically pure theory. Can this say that this and this?
It's much more complex, and you're dealing basically with different personality, character traits. You're dealing with neshamas. You don't put a person into a therapy, into a treatment. You basically have the treatment fit the person. I always say when people come in, listen, I'm working for you, and the treatment is custom made exactly for what's happening to you. People will call me up. I always say, I don't know if you need one category treatment. You might need two. You might need to be emotionally removed from a trauma, like my friend Leon here specializes in, and you might need to be. You might have an anxiety problem as well, a different type of treatment. It has to be made to measure. Now, a few things I think are very, very important that me and Nissim really spoke about, that we want people to understand. There is, a view, yes, they've had this problem for 10 years, it'll take 10 years to cure. Forget about this view, and I will be extremely against this and speak about this view publicly. It's not the way to go. And again, any treatment, whoever is helping you, if it's working, fine. But you should know that if you go for treatment, you should begin to, whether it's anxiety, whether it's depression, whether it's OCD, which I specialize in, or anxiety, you have to know, okay, let's see what happens when people tell me, how long will this take? You know what? You should begin to see results in 4 sessions, 6 sessions, 8 sessions. But if somebody's going to tell you, you got to close your eyes for a year, this might take 5 years, 10 years, something's not right over here. You should begin to feel better. If you're going the right direction, I'm not saying a cure right away, but let's get 10%, 15%, something within the first month, within the first 3 weeks, 4 weeks, 5 weeks, something you should see. Now, when you see a change, that means, hey, thank God, I'm on the right direction. It can continue. That's one thing. Another thing I would like to say that might be very controversial, but again, I have Gdoili Yisrael backing me. Alav Shalom, Rav Palm. I remember walking him home and saying many, many years ago, when it comes to Shalom Bais, helping couples, so I do very differently, and I all the years believed that, and I'm not alone, Aaron Akoyan did the same thing. Oyev Shalom, Roidev Shalom, he goes to one person, he speaks to them, then he goes to the next person. Now let me ask you, if you were a surgeon and you have 2 people in front of you, you could do surgery on 2 people at the exact same time? So if you have 2 people coming in front of you for Shalom Bais, you're basically, if you really know what you're doing, you will never want 2 people at the same time who have a real problem and are arguing with each other in front of you, because you will not be able to do the surgery to figure things out simultaneously. You would want first to hear from one, decide what's going on, what you need to do, hear from the other. Now, Davar Yotzim in a klal comes to teach on a klal. In other words, the exception comes to teach on the rule that sometimes the cases, especially when I was younger, that I would accept would be the cases, the more difficult cases. I remember Rebbetzin Shengarten, Aleh Shalom, was from the first to send me her hardest cases. And a lot of times when it comes to marital problems, what happens is there's such negativity that just by the couple looking at each other, they see the lines on each other's foreheads, and that right away reminds them subconsciously and consciously of the negativity that they share with each other. So in other words, any therapy, any marriage counseling will not work because they see themselves in a negative way. What I always say is they need basically, I would do hypnosis before the counseling just to get them on a neutral level, and then you reevaluate them. And only when you get to the higher levels, like I remember speaking to Rabbi Belsky about this, he agreed with me also to see them separately, but he did mention at one point, as things get better, to see them together. This goes back many, many years ago. Okay. So again, it's very, very important for the educator to say, listen, I want you to speak to so-and-so, or a specialist in this area, like Nissim said, a specialist in that area, or an Adam Gadol, a Das Torah. But it's very, very, very important to know, it's like in my old office, I would have a top psychiatrist who does research in the actual factories where Paxil is made, where Prozac is made. He would go to the actual companies and research their, and look into their research. So he would go behind the scenes more than all the other, if you look at it, a level C, a level B, I would get the insides on that. So I would have him for that. I would have another Adam Gadol that I would ask Shilas, because I would have chavrusas in between clients. And I can't mention, that name, but an Adam Gadol I would have his hotline at certain hours to call. So it just shows that I always say to people, you want advice, like Nissim said, want a top dentist, you want a top leg surgeon or orthopedist, you go to that person, and you're not sure, you ask around. And that is very, very important. And I really hope, with Hashem's help, that in the future, the schools will all be equipped and know there are problems in these areas. This is who we speak to in the school, and they have, who to call to, who to ask a question to, what should they do with such an issue, but not to take it into their own hands. I've heard very recently as well, a child is caught doing bad things. They kick them out of the school. Something like that could destroy a person's life. Very nice for the school. They don't have the child. But what's the child going to do now? They're going to see themselves in a negative way the rest of their life. They're a failure. You're destroying a person's life. I was very surprised that I experienced such a thing firsthand, that somebody told me about a specific case. And I was very, very shocked that the educators, again, you give a call. I don't want to mention names, but there are people out there who deal in Kiruv, who know how to handle such cases, who the child could, and you could enforce that, yes, you need to see this person, and this person's warm, and they want to help you. Not to look at them as bad, to look at them, yes, they have certain issues, they have certain problems. It's a Jew crying for help, and this is how it needs to be seen. And somebody who's emotional, they are dealing with it in an emotional way. I mentioned the word surgery when I spoke about Shalom Bayis and other cases for a reason, because the true therapist, yes, needs to have a heart, needs to, you're dealing with Jews, you need to look at every Jew separately, but you're basically solving a specific problem. You do not want to be diverted and lead a person astray, and people shouldn't be led astray, and they should end up with the right people, and know that, yes, you should begin to see certain results. If it goes the other way, and the pain is worse, or the Shalom Bayis is worse, don't let somebody tell you, oh, you know what, it's supposed to get worse before it gets better. You know what, in terms of being a Jew and living life as a Jew, that might be true, but in terms of therapy, that is definitely not the case. And, okay, if there's any other questions, please feel free to call. You can reach me at 718-683-5858.
Yes, you know what? It's still, I am still stuck on the. I got, that's what I saw and what I see every single day, and it's unfortunately become, it's almost like epidemic that I feel that everybody crazy, everybody need therapist. The word is therapist. Therapist, and it's like sound. What I, again, what I get feedback from I would say from the field, that not all the time I would say that it's a right decision. Many times you feel that it's a power game, it's a money game, it's finance. And what I look at from my own short life experience, that השקפה, אמונה, and סבלנות is the best treatment to all of us. And if we penetrate it to our brain and to our daily life, that what everything, we don't need nothing. I know that I'm cutting the branch that you're sitting about it, but that's basically what I believe, and that's what we believe here on the radio also. That really it's amazing, because I heard, for example, stories about a dentist. I don't, chas v'chalila, it's not in our, not in our Yiddishkeit, but in dentists they're doing other treatment that it's not belong to the video treatment, And, many stories, horror stories about things that not supposed to be, that people trusting you sit in the chair of a doctor, supposed to be, and it's supposed you beneficiary, and then Stefan, you said that the doctor want to grab you, and another session, and another trip. Okay, so we have so many phone calls. Okay, so we are, I'm out.
Okay, you're on the air with Dr. Baharav.
Probably unfortunately it fell down. Okay, but we're waiting for another phone calls.
Okay, now it is very important to go to somebody honest, to somebody reliable in every field. Okay, you're on there with Dr. Baharav.
Yes. Let's see, you talk about children. A child in class.
I'm sorry, if you could speak a little bit louder, please.
You talk about children. A child in class, let's say a 5-6-year-old.
Yes.
Has a problem sitting. And, gets out of his seat, he can't sit. And the parents are saying, well, I took him to a doctor, a regular doctor. And they say he's a regular, normal 5-6-year-old. That, is healthy, and that's what he does.
Does he have anxiety?
The one of his teachers says, yeah, no, but he can't sit. So how do you look at this problem? The parents are saying, a parent will say, I took him to a doctor, he's a healthy 5-6-year-old. I once said that the doctor is not a chinuch. You know what I mean? Sure, he's a healthy 6-year-old, 5-year-old, but there's a problem sitting.
Does he have anxiety?
The child?
Yeah, it's very, very important. Now, I don't mean an anxiety disorder, but I mean, is there some type of level of anxiety? He gets angry fast. Does he have a certain level of anxiety? It's a little higher than average.
I don't think so. No, I don't think so. There are children. You're right. There are children that have anxiety, have certain problems, and you have to in the home. And you're right. But let's take a child that you made inquiries. And
how is he at home? Is he at home also like that?
In home also he has a problem sitting. Yeah, but you're right. The home also he has like a problem. They're not denying that, but still they're saying like what do you want?
He's agitated, right? He's agitated at home also.
Well, he can't sit at home too.
He's agitated. I mean, like he's agitated. Like you see his shoulders moving. He's like.
They say he can't sit at the Shabbos table too long, and homework he can't sit too much. But on the other hand, the same mouth is saying that. The same mouth is saying, "What do you want from him in class?" The doctor said he's healthy. That's what he's supposed to,
Yeah.
A
So
5-6-year-old can't.
Yeah, I'll tell you like this. The way it works is that everything we see, everything we hear is basically based on the perceptions of our mind, not only emotionally, physiologically. In other words, if you go like, boo, make a sound, how will your heart beat? How will your mind understand that? It's like a reflex, an automatic reaction. Now, his confidence is low?
His confidence low. This particular child, I mean, I'm looking at 2, 3 children. You know what I mean? So I'm trying to go back and forth. I'm trying to take the child that has the least. What you're saying? You know what I mean?
He takes things hard, difficult making decisions, doesn't accept compliments, takes criticism hard. Do these things sound familiar with him?
Not really. No. Because the children I'm working with, every child loves praise.
Every child what?
Loves praise, you know what I mean?
Yeah. I mean, put it this way. Chances are that he's experiencing anxiety at certain levels, and that's why he's not relaxed and able to, have the sitzfleisch, to the patients to be sitting. Some kids are just, more active than other children. I'm not going to diagnose over the phone. So It might be, the question is me and Nissim always have these conversations, and it always basically ends up on what level are we talking about? Like Nissim used the word therapist many, many, many times. So I will answer you in such a way that's in an intelligent way, that it all depends, what are we talking about? Are we talking about, in an hour lesson, he wants to stand up twice? Are we talking about, is it happening very often? If it's something that's like really noticeable, then it's something that he might be agitated. He might have a certain level of anxiety. If it's just like a kid that's very, very active, and so it could be a perfectly normal thing as well. But it's very important to make sure that he doesn't have something disturbing him, or he's not very anxious. And you're free to call my office, and it really all depends on the level and how often, the extremity of what is it. Is it the level of Nissim, what he's talking about? Torah Hashem Tmima Meshivas Nafesh. He needs to be relaxed. The Rebbe needs to speak to him. Or is it the level that I'm talking about, where, Torah Hashem Tmima Meshivas Nafesh, but you got to be on that level to let it relax you, because somebody, God forbid, with a broken arm or an anxiety disorder is not even able to get to that level that the Torah should relax him. That's really that's a summary of how we're talking really on different levels. So that's why it seems like we're talking in different terms.
But we're talking about young children. We're talking about.
No, I understand, but still, anxiety can exist in very young children as well.
If they come from a hard life at home, you know what I mean?
It could be, put it this way, the way it's going to work, and we got to... Yeah, the way it's going to work, and I'll explain, because this is very, very important. So basically, reality doesn't mean very, very much. What is important is the person's personality and character will basically filter out what's happening in the outside world, and based on that, it will create certain images, perceptions in their mind, and that will determine how they take everything they see and hear, both emotionally and physiologically, and that will possibly bring out, if the levels are low, it can bring out an anxiety disorder or an issue with anxiety.
Let me just one more question. I don't keep the.
So even though everything seems great and everything's good at home, most of the cases are not like that. But I've had a lot of cases like that. So it's not for the listeners not to be fooled by seeing the background and saying, oh, this child is fine. If it's something a little more exaggerated, or something that somebody who has, quite a few children, or they're older, they're experienced, they've seen things, and all of a sudden they have a child in class that something's a little off over here, a little different, they should, contact the right professional. Okay, we got to move on. Thank you
so much.
I hope I answered your question.
Hello, you on there?
Hello, I have a question to...
We lost you. You got to call back.
Another one. Hello, you on there?
Are you there?
Yes, hello.
We are here.
I guess these are all difficult questions to discuss in the air, but I'll do them anyway.
Oh, you just have to speak loud, please. I can't hear you.
From my adult life, I've had a problem with constipation.
I'm sorry, from the beginning?
What?
Could you start from the beginning? I didn't hear the first part of what you said.
For most of my adult life, I've had a problem with constipation,
Okay.
which continues. I do make once in a while, with the aid of Metamucil or other quote-unquote laxatives.
At what age does it start?
I eat a fiber-rich diet, and I've always felt there was something in my psyche and something in my mind that caused this problem.
Is the diagnosis irritable bowel syndrome?
No.
What's the diagnosis?
I'm perfectly healthy, no diagnosis. Eat a lot of fiber.
Oh, you just have a problem with constipation.
Right.
You never went to a gastro? They never said anything?
I did. I'm perfectly normal. Nothing wrong.
Okay.
Now I have a very serious disease, which brought this out in an exaggerated form.
Just a little loud, so hard to hear you. I'm sorry.
I have a very serious disease, which brought this out in an exaggerated form.
What, the constipation?
What?
Because of what you have now, the constipation is worse?
Yeah.
Okay.
And I've always felt very strongly, and it was confirmed by the fact that I have no irritable bowel syndrome.
I'm sorry, it's confirmed that what? You got to be clear. Could you repeat that, please?
It was confirmed by the fact that I have no medical problem associated with it, that it should be dealt with in some other way. And I do eat a fiber-rich diet, and I do take Metamucil, and even with that, I find it difficult to move my bowels. So I don't measure constipation necessarily by the number of times that I relieve myself.
Yeah, I understand. Do you have, I would have to speak to you a little more in detail, but do you have a problem with anxiety at all?
Great depression. Is that anxiety?
Oh, you have strong depression?
Very strong.
Okay, because the mood is going to, again, for the listeners, it's very, very important, because you'll hear me say this a lot, because I just want the listeners to understand how the system works. But the subconscious mind is going to work with the autonomic nervous system. The stomach, the bowel, is a very sensitive area for many, many people, just like the lower back, maybe even more than that. So whether it's anxiety, whether it's depression, it will affect the bowels. It will affect the stomach in a lot of people, especially anxiety. Sometimes it could work both ways. It could lead to what you have, and I'm sure you've heard people are nervous. It goes the other way, and they're running to the bathroom. But that is probably, from hearing from hearing a little bit about what you said. By the way, irritable bowel syndrome, like I heard from Dr. Kodsi, the elder one, many years ago. I was from the first patients ever to have a colonoscopy without putting me to sleep. That irritable bowel syndrome basically doesn't exist. It's a diagnosis of exclusion. In other words, when they don't have what to say, they call it irritable bowel syndrome. That's actually a quote from him. He's a gastro in Borough Park. Now, probably, it seems, I don't like to diagnose again over the radio, but I wouldn't take this depression lightly, and depression does come with anxiety, because definitely the mood can affect that.
I'm not taking it lightly at all.
I'm sorry, yeah, and that's why I would want to see, you might be taking certain medications as well that might be affecting, but usually I always say, and I think this is important because the topic that Nissim, we're talking about today, is that really what you want to see is the person for the right diagnosis, which I'll continue after I speak to you. You want to see the person, how are you? I see depression. So before going through, I'm sure you had medical tests and everything, I want the depression better. I want you to feel better about yourself. I want you to feel good. Then we see what's happening with the constipation. Okay? So that's the first thing that you really want to treat. I'm sure you did all the physical tests. But if you see depression, that could definitely contribute to any, or anxiety, like psychiatrists have told me, could, contribute to any physical problem. Even somebody can get fever.
Beginning of the show.
I'm sorry?
What is your name and number?
Oh, my name is Dr. Baharav, and the office number is, Baharav, and the office number is 718-621-2179.
Baharav, can you spell
Baharav. Baharav at 718-621-2179. I wish you a lot of luck. Thank you for calling.
Thank you, and have a good night.
You too.
We have another listener, but before we getting the other listeners, isn't the case of the chicken and the egg, or the egg the chicken? The question like this: if he has the anxiety because it's constipation, or constipation because of the anxiety. So the question like this: if he go to a nutritionist and get something better to get, and maybe the anxiety will go down. So this is also an issue. I'm throwing bombs here today.
No, it's a pleasure.
I'm right now on a.
I always say,
yes.
The best thing about this show is that if I'm speaking about a topic and I'm basically, the callers call in with all types of questions, and then I have on the other side of the table, I have Nissim. So together we get a very rounded picture of the topic with all the answers. I just want to say one important thing before I answer that question, because there's another thing that I don't forget, is that I always tell my clients, look, if somebody's carrying packages on their shoulders and their leg hurts, so what's the intelligent thing to do? I don't know, something's wrong with the leg. Or somebody comes in, they have a headache. Oh, did you sleep enough? Did you eat enough? You want the person to take off the packages off their shoulders and then see, how is your leg now? In other words, even if the therapist, the doctor, they have knowledge, but you need something a little more than that. In this area, you need a chochmas halev. You need an understanding heart. You have to think logically. You have to think, wait a minute. Somebody called me over here. The doctor, they don't know what's going on. He has constipation. Now, what else could be causing that? Somebody's mood could cause that, and he could go for surgeries, God forbid. He could go for medicines for who knows how many years, and nobody would even ask him, listen, you have anxiety, you have depression. What happens in a case like when Nissim asked me, the chicken or the egg? So what's going to happen in such a case? Well, it's going to be the anxiety causing the constipation, because constipation, I mean, we should know, but this bothers the person, but it won't make him anxious to such an extent that if you would take that anxiety and throw it on somebody else, that would make them constipated, because it would be a lower form of being bothered or troubled, but it wouldn't be such an extreme anxiety that would cause constipation should you take that anxiety and transfer it to another person.
I didn't have this issue, but I'm telling you that if a person...
But the answer is interesting, right?
For a week or 2 weeks, and it could be very paranoid about it. Okay, let's take another call. Hello, you on there? Hello?
Yeah, hi.
Can you
Yes, I have a question, and I'm glad I could be anonymous, because normally I would be embarrassed to talk about it.
Okay.
Sure, you're anonymous.
But do me a favor,
okay.
Can you lower the radio on the background, please? That you want. Hello?
Yes.
Yeah, hello?
Yes, go ahead.
Yeah, no, I'm in a place where there's some noise. I'm sorry.
Okay.
No, basically, I've had a problem that I've struggled lately with for many years with, just one second, okay. I have a problem. I struggled with self-injury, and it's something that I've been doing on and off. Nothing like dangerous, nothing like really dangerous, but kind of like hurting myself, like bruising, bleeding, whatever. And It's been going on for like almost 30 years, and sometimes I think I'm cured, and then I start doing it again, and I haven't been able to get off it. And I just want to know if hypnosis would be helpful, because I don't really know that much about hypnosis. I don't know how it would affect me. Because I've tried, and I've
okay. First of all, the first question is
I can stop.
Yeah, the first question is, do you do this when you are nervous, when you're upset, when when do you do this? At certain times?
When I have anxiety. I have extreme anxiety. The anxiety gets worse and worse, and then I just can't control myself, and I just do it.
Okay, so again, I want the listeners to understand, because we're speaking about a special topic today that me and Nissim spoke about, and it's really much, much deeper in terms of how to get the right help, where to go. How do you look at things? I want the listeners to understand treatments the way or better than the therapists and the doctors understand it. Now we have a call. I want the listeners to actually try to imagine in your mind, what would you answer this person? You have all the answers in front of you. You just heard, okay, look, somebody's injuring themselves. It's going on for 30 years. My goodness. 30 years, they're injuring themselves. They've tried everything. They went to specialists. They went to here. They went there. What are we going to tell them? So I'd like the listeners to just imagine, what would you do with such a person? So first of all, unfortunately, I hear that you went and you tried to get help, and you have this problem for a very, very long time. But it's extremely, extremely simple, because it's a very complex problem if we make it complex. If we look at, okay, let's look at self-infliction. You have certain issues, you have certain problems, and you know what? I would be happy to help you with that, but I really want to teach the listeners, okay, because it's something that I think we're going to dedicate a little bit of every show for next little while, just to educate, educators and the listeners, that they can help people from all over, at least to direct them in the right place. The real giveaway is for the listeners to hear that you would be able to solve this problem, not solve it, but you would know the right direction, which is, it only happens when she is nervous. That's true?
Yes. Anxiety.
Okay. Anxiety. Again, the person that I'm talking to, anonymous caller on the phone, even though it's going on for 30 years, self-infliction, something serious, I'll be honest with you, you'll call tomorrow, 5 psychologists or psychiatrists or whoever you want, and she could be in treatment for 10 years, 15 years. Right now, the listeners are hearing, and the answer is, she only does it when she has anxiety. Therefore, a very easy, simple treatment that I can do in the office with anxiety, that you begin to see results within literally a few weeks, if not less, 4 or 6 treatments or a month, and it begins to become lighter. As anxiety becomes lighter, which can be cured completely, okay, with Hashem's help. So what's going to happen is that self-infliction is only working on a certain level of anxiety. In other words, it takes a certain level of anxiety to bring up that need and that unstoppable condition of infliction. So therefore, treating the anxiety seems like a separate thing altogether, but when that's taken care of, your 30-year problem is gone. So I want the listeners to understand that a lot of times things work indirectly, and they don't have to go through a whole treatment their whole life. Just like in the cases we spoke about, OCD or anxiety or especially trauma. There are simple ways to solve this. Okay, so I'm very happy you called, because you taught the listeners an important lesson, and we were able to demonstrate it without expecting your call. So I really appreciate your call. And again, the listeners, somebody with a problem with infliction, again, we're not generalizing to everybody. Like I said before, we're Jews, different personality, character traits, different neshamas. It's made to measure for the person. But I can assure the one that's calling, for you specifically, a treatment for anxiety, as anxiety is lighter since it only happens when you are anxious, that will stop the actual infliction. I thank you so much for calling.
Thank you. Thank you. Bye.
Bye-bye.
Okay, thank you. We have a text message about, let's see, let's hear it. 1 second. What is this? And it's how much does anxiety have effect for a woman trying to become pregnant?
Oh, that is something, like I said, you give me a great opportunity to say again, Le'olam yargil adam etzatzma lo yimar eini yodea. In other words, I want you to call your obstetrician, and I want the listeners to hear that I actually answered a real question with I don't know. I want you to ask your obstetrician. I might be able to answer it in a certain way, but I purposely will not, because I want her to get the answer in terms of statistics, in terms of her age, in terms of was she expecting before. How does anxiety affect her specifically if she's trying to become pregnant? I have no idea if the person who texts is 25, is 40, is 35. It's a very general question which you yourself have to go to your obstetrician or a top obstetrician, and if you have trouble becoming pregnant, ask them in terms of that. If you have a serious anxiety problem and they tell you yes, it in your case is affecting you a lot, because I know that weight can affect and anxiety can also affect, but they should tell you specifically to what degree it's affecting you. I don't want to generalize, and I never do. Then you're welcome to call, and we'd be happy to help you. But you need to find out for your specific condition, and that's really what this show is about. And what me and Nissim are trying to get the word across, to go to the right person for the right questions, with the right age, with the right conditions, with did you have children before? And that's where you get your answer. If you need to reach me again, listeners, you're hearing Dr. Baharav at 718-621-2179. That's my office number. We only have a minute or two, so if there's any other questions.
No, we're right now basically less than a minute, so just we conclude this show. Okay.
Okay, so thank you so much for calling. And again, Le'olam yargil adam etzatzmo lo yimar eini yodea. And I really thank the callers, the listeners, that they asked the right questions, and it enabled me and Nissim to really get the word across in terms of to go to the right person, especially, the two last callers and the text. I really appreciate it, because you really helped us answer one of the most important issues that we wanted to discuss. Thank you so much.
1 second. I would love that if you translate the Le'olam Yargil and the.
Yes, I'm gonna translate the Chazal Le'olam Yargil Adam Etzatzmo lo yimar eini yodea. It says Le'olam, forever. Yargil Adam Etzatzmo. A person should always get himself used to saying the words Eini yodea, I don't know. He should get himself used to saying the words I don't know. I hear from a lady that is asking about anxiety and childbirth. I don't know her age. I don't know if she had children before. I don't know the level of anxiety. Okay, she's not on the radio with me. It was a text. I can't answer such a question. She has to go to her obstetrician who knows all her medical records. Okay, so I hope the listeners have learned a lot, because we all have today, and we thank Hashem for that. Have a great night. All the best.